This movie gives an overview of the relevant steps that must be considered when installing i3 disposable water filters. These include, in particular, the hospital's internal hygiene regulations. For installation, we recommend the use of a service trolley to store all filters and materials hygienically and safely. The work surface should be wiped with common disinfectants in advance. Use the change protocol provided by i3 Membrane for correct and complete documentation. Take the i3 water filters required for each patient room out of the outer packaging and stick the yellow outer label of each individual filter into the change protocol. Disinfect your hands before entering the patient room in accordance with your faculty's requirements. Take the unopened filter bags into the room and place them in a suitable location. During the initial installation, the aerator must be replaced with a suitable coupling. Before uninstalling the filter, the quick-release adapter must be checked and replaced if it shows any defects, such as greenish deposits. To remove the i3 1 disposable water filter, press the snap closure on the adapter side. Take off the filter and place it in the sink. If necessary, a new adapter can now be installed. Open the transparent vacuum packaging on the filter inlet side. Leave the filter in the bag and use it as protection while you insert the filter into the adapter. Note the 10-degree inclination of the connection nozzle to avoid jamming the filter in the adapter. You will hear a click when the filter has engaged in the adapter. Then pull down the film packaging from the filter and use the bag to grasp the old filter and dispose of it. A function check after installation is essential. Make sure that no water runs out of the tap over the water filter and that the filter is not defective. The leakage of non-filtered tap water from the side can pose a risk to patients. If no water comes out of the filter outlet, it has not fully clicked into the adapter. In this case, try to click the filter into the adapter again. Check the position of the i3 1 water filter. The water jet should not hit the drain hole directly. If necessary, turn the filter so that the water jet hits the sink as far away from the drain hole as possible. This helps to prevent contamination of the water filter by aerosols from the drain hole. For the installation of the i3 2 direct shower sterilizing filter with integrated thread, turn the existing filter off the hose and place it in the sink. Open the transparent vacuum packaging of the new i3 2, direct at the filter inlet side. Leave the filter in the bag for now and use it as protection while you screw the filter into the shower hose using the thread. Make sure that the sealing ring is correctly inserted into the shower hose and that the hose and thread are not damaged or porous. Turn on the water and perform a function test. The water should only come out of the jet disc of the i3 2 filter. If unfiltered tap water comes out of the side, it can pose a risk to patients. Grasp the old i3 2 filter with the bag and dispose of it in the patient's room waste bin. To install the i3 2, connect disposable water filter. Disassemble the existing filter by pressing the quick release coupling. Place the used filter in the sink. Open the transparent vacuum packaging of the new i3 2 Connect at the filter inlet side and leave the filter in the bag while you mount it by clicking it into the quick release coupling. Make sure that the shower hose is not damaged or porous. The quick release connector should be visually inspected and must be fully functional. Turn on the water and perform a functional test. The water should only come out of the jet disc of the i3 2 filter. If unfiltered tap water escapes from the side, for example, at the quick release coupling, it can pose a hazard to patients. Use the bag to grasp the old i3 2 filter and dispose of it in the patient's room waste bin. Carefully disinfect your hands in accordance with your facility's requirements after leaving the patient's room. Document any deviations, such as porous shower hoses or defective fittings, on the change protocol, documentation of filter change. The i3 water filters have a 0.2 micron microfiltration membrane and retain all waterborne germs. During the service life, contamination can quickly occur on the i3 1 water filter, for example, from toothpaste or shaving cream residue. Therefore, we recommend wiping the water filter with a disposable wipe after cleaning the sink. It is important to also wipe the underside of the filter with a disinfectant wipe. The i3-2 water filter should only be hooked into the shower rod. If a filter is placed in a shower tray with soap and water residue, it can lead to massive contamination through the openings in the filter head. No objects, such as towels, should be placed on the filter. Therefore, inform your patients about the correct use of filters. If the disposable water filters are used improperly, they must be replaced immediately. If water samples are taken by hygiene specialists or technical personnel, or if temporary mobile dialysis machines are used, a new filter must be installed afterwards to minimize the risk of contamination, even before the end of the usual service life. For questions regarding the correct use of the i3 disposable water filter, please get in touch with your contact person.